Hello everyone, welcome back Voice of Care Caring from the Heart by Pantai Hospital Ipoh. I am your host today, Dennis. Today we have with us consultant pediatrician Dr. Sushinta, and we were talking about the topic every parent care about, childhood vaccination. Before we dive in, could you briefly introduce yourself?
Hello everyone, I'm Dr. Sushinta Samudram. I'm a consultant pediatrician from Hospital Pantai Ipoh. I've been practicing here for the past 2 years. Quite glad today to be here to share a bit knowledge with the parents around out there to know more in depth about your children's care.
Thank you, Doctor. Great to have you with us today.
Thank you.
Doctor, many parents today feel overwhelming with the number of vaccine recommended for children. How do you explain the importance and the safety of this schedule to them?
As a parent, I think it's always a fear within them to give the best care for the children, especially the first time parents. So they will always be worried about the vaccination. And of course, their biggest fear is the pain for the child. Always starts from the antenatal, I will say. When the mother pregnant itself, we have mothers already receiving the vaccines. The knowledge of benefit of taking vaccines of certain diseases to be prevented from the womb until the baby out, and then for every stage of the life. This vaccine is basically preparing our child into developing an army of immune system to fight more infection in future. So the first 2 years is always the important milestone, and also the developing immunity. Usually we will advise the parents to fear not, take a step at once. After baby is out, we will usually brief them what are the vaccines we will give. Usually at birth, we will give the hepatitis B, BCG, vitamin K. And it's important to explain, all I will say is all the communication. Why you give, and then the benefit. So once the parents know the benefit of the vaccine, they'll be more welcoming in accepting these vaccines. For the first 2 years, the vaccines will be usually they receive at monthly schedule. It can be both in the national program and also the additional vaccines from any private healthcare system. The other thing that can overwhelm the parents actually the time. They need to take the child to a doctor and visits for every month, and at the same time the cost. So there are parents who choose to come to healthcare, private healthcare, because it's more time saving. At the same time, cost also another burden for them. But looking at our hospitals, we do have a lot of discounts now, and this is in a way to actually to promote parents not to miss vaccination, and also assist them if they have restriction of time, and they can save time and cost if they can enroll in all these vaccine programs.
I think parents will feel more confident here that there's a lot of misinformation online about vaccine side effects. What are the common side effects parents can be expect? What are the true red flags that requires medical attention, Doctor?
Okay, yes. This is one of the biggest challenge where the parents will actually ask you more questions and also to clarify further. With more data and information from the social media, TikTok especially, and then also the other parents' experience, there is an era of anti-vaxxers out there, promote and also share a lot of information which make parents to be confused, especially some vaccine can be associated with autism. It can be from the parents who previously has children and they have overlap symptoms. So there's no study proven. This is where the communication comes in. During every vaccination, we have to reassure parents. Once the vaccine taken, the child will have two kind of side effects. One is a local side effect from the side of injection, and number two is a systemic. They may develop the reaction to the whole body. So the minor and also commoner side effect usually a mild swelling, redness, and also pain over the injection site. So the advice will be try not to touch the area, handily minimize the pain. At the same time, they can give some pain reliever if that's cause discomfort to the child and refuse feed. The other systemic commonest side effect is actually a rise in body temperature. So they do have a rise in body temperature, fever. It can last about 24 hours. But if any fever that is more than 24 hours persistent, with other symptoms, the parents should actually get a medical advice so that it is not an infection rather than a vaccine side effect. The red flag, usually we worry about anaphylaxis, which is a severe allergic reaction associated with severe body rashes, swelling of the eyes, and also swelling of the lips. This can consider the most severe side effect. We have to notify this to the healthcare. If this happen associated with the vaccine, advice and measures should be taken before the next commencement of the vaccine, whether it's safe for the child or any other option to be given next.
There is a distinction between a normal and the red flag symptom will definitely guide many parents on this. Some parents worry about giving multiple vaccines at once, thinking it might overload child immune system. Is there any scientific backs on this concern?
When come to vaccine, we are actually introducing a component of the certain illness, what they call particles into the body of the child, so that the child can develop antibodies and reserve it like an army, before any infection arises, so they can fight towards the infection. To give in what they call vaccines, more than one at one time, it all depends on the vaccine. For example, if you take a rotavirus, it is an orally taken vaccine. It is safe to give during the injection site. And at the same time, there are vaccines that can give on both sides. For example, you want to give an hexacin and also pneumococcal on the both sides. Shouldn't be an issue because the way they react, whether the component that we're giving is live attenuated or the weakened virus, they have different mechanism of how the body mount the what they call reaction. Most of the time, we do give both sides simultaneously together if the child has missed immunization for some reason. For example, you have taken the second month, third month, and then fourth month the child couldn't take because of fever. Of course, fever is a contraindication to take any vaccine. So when the child come back to you at the subsequent month, we don't want the child to miss the vaccine. We don't give 2 doses of the same vaccine. We actually try to give 2 different vaccines at different sites, not from the same site. This is actually a safe measure that we can give, but definitely under the doctor's advice, not just simply taking without any proper pediatrician advice.
That makes a lot of sense. Could hear that immune system is actually very capable. Doctor, for the children with allergy, asthma or other health condition, how do you assess it is safe to vaccine? Or what precaution do doctor usually take?
Allergies in children in asthma is actually a family of atopy. So they develop hypersensitivity reaction. It can be from cutaneous, which can be from the skin, or can be up to asthma, wheezing problem. So this actually body's hypersensitivity reaction towards any infection or any triggering factor. It is not an absolute contraindication to take any vaccine. You are safe to give vaccine. You just have to inform the parents to take care of the side effect. To be honest, up to date, even a severe asthma child, I don't see any of them actually develop allergies from the vaccine. Perhaps vaccine do help to save their life. For example, we have taken enough of pneumococcal vaccine and influenza per se every year. So we do see patients who actually do have less exacerbation in asthma attacks because they are more protected from the vaccine rather than vaccine causing them to have more allergic reaction. We have to be clear in these 2 statements.
Great explanation, Doctor. Doctor, from your past experience, what are the bigger benefits you observe in vaccine children compared to unvaccinated children, especially during school year?
School year children is actually the most vulnerable group who will develop recurrent infection. Overall view, I will say that for a child who start to expose to the outside world, for them to get unwell every 2 months, cough and fever, flu for every 2 months in the first 2 years of life, usually is normal for them to develop the immunity. My personal opinion from what I see from the reason I practice with this pediatrician is actually when you're vaccinated, they actually do come with less severe of the infection, especially when the pneumococcal. Previously, it wasn't in the national immunization program. Only the last 5 years it was included. So before that, when I was in a government practice, I do see many child who come with just cough and they end up with pneumonia, and the pneumococcal infection spread to the brain, cause them to have a permanent damage and also a complication for the child, which they carry for the lifelong. The same thing goes to influenza as well. They do have a patient with meningitis spread to the lung and then become very severe lung scarring and what they call went to the chronic lung disease. So with this vaccine, pneumococcal in our national immunization, so we do see less of patients who have a pneumococcal infection. At the same time, influenza per se, we do encourage now for them to take every year. We do start to give from 6-month-old of age. They do get 2 doses with 1 month apart up to 5 years old, and we advise them yearly after 5 years old until the school aging. And for example, we healthcare, we do take every year as well. So this influenza, this flu vaccine is actually really protecting them from getting a severe infection. Even we can do see the examples in the ward when one sibling is vaccinated, the other one not vaccinated. The vaccinated actually develop only very low grade fever and they do resolve within 24 hours. And the unvaccinated child actually develop very high fever, 39, 40. The highest I've seen 41, and take about almost 48 hours for the fever to come down. They do end up with febrile seizure as well. They also developed complication of low white cell, low platelet. But the vaccinated group actually did not show such side effect from the infection from influenza. So if you ask me, one of the clear, most beneficial in school-going children now, after they completed the compulsory vaccination, is actually influenza, one of the most recommended regular yearly vaccines for our children.
Very true, doctor. Prevention really is better than cure.
Yes, true.
Yeah. What new or upcoming vaccination should be parent aware? How will it help improve children health in the next decade?
Of course, we are quite well versed with all the current national vaccination, and also the additional vaccination that we do have, that is rotavirus, meningococcal, Japanese encephalitis, hepatitis A, chickenpox, and also for the influenza. It has been there for very long, but going to promote more is coming up RSV and also dengue vaccine. The importance of RSV vaccines actually is quite deliberate for those infected with RSV infection for those less than 1 year old. So RSV vaccine now, we actually do recommend for those mother from in utero. If the mother has taken the vaccine when they are pregnant 30 weeks onwards, they do provide protection for the baby up to 1 year old. Or they can even take when they are born. After they are born, especially those for high-risk groups, the premature babies, those with lung problem, heart problem, it's advisable to take RSV vaccine. It's really a life-saving vaccine, because the infection can actually cause mortality more worse than not taking the vaccine. And dengue, yes, it is there. It do provide some protection. We do also advise for dengue vaccine. Usually comes in 2 doses with about 3 months apart.
Dengue vaccine will be taken regularly, or how?
Oh no, it's just a once in a lifetime.
Once in a lifetime.
RSV also is only once. It protection up to from the baby born up to first 1 year of life. It is not advisable for more bigger children. It's more to the infancy period.
So mother of, please take care on this. Before we end today's session, doctor, do you have any final advice for parents regarding the childhood vaccination?
Dear parents out there, we as a parent, we are the one going to mold our child, and also we are the biggest reason why we need to take care of children. Their health is in your hand. To be a safe mother, a safe father, so it's best to vaccine them. Fear not. Any doubt, anything that you are not sure, anything that you have seen anywhere, please come and get your opinion. Definitely you have all the rights to decide after getting all the clarification. If you have missed vaccination, you do have catch-up vaccinations. Fear not to approach the health center. Please do come and continue your vaccination. Be safe. Vaccine save lives.
Wonderful advice. Thank you, doctor. And that wraps up our today's episode, Voice of Care, Caring from the Heart, by Pantai Hospital Ipoh. A big thanks to you, Dr. Sushinta, and sharing such value insight. To all our audience, stay tuned with us. Remember to follow and subscribe to our Facebook, Instagram, TikTok, and YouTube for more health tips. Stay informed, stay healthy. Bye-bye.
Bye.